we know high blood pressure is a silent killer, right? It's associated with cardiovascular disease, stroke, readmissions, and even heart failure. A lot of patients aren't tolerant to medications. Some patients are non-compliant to medications that treat their blood pressure. And because of that, having this new therapy, which actually denervates the renal nerve. So the belief is that your renal system controls a lot of hormones that are released to control your blood pressure. And some patients will have an overactive renal nerve driving the blood pressure up. What this device does, or technology, we go inside the renal artery with a small balloon measured in size to the actual vessel. We use a special device that measures inside the vessel, so we have exact measurement, and sends out pulse signals that denervates the nerve, kind of going from overactive to non-active. With the intention is that these hormones aren't released, the blood pressure come down. We tell our patients, you're not going to come off all your blood pressure medicines, but if we could control it with a few, they have a much better lifestyle. Because some of our patients will be on 4 or 5 and just struggle throughout the day keeping up with their medicines. Typical patient is someone who's on multiple blood pressure medications. They may have allergies or intolerance to some, so we've kind of maxed out what we could use, and it could be underlying renal dysfunction, allergies, as I mentioned, and they're really struggling to get their blood pressure under control, even despite compliance. And those are the ones that we're targeting off the bat, who would gain the most benefit. Age is really not the prohibitor, but as you can imagine, as you get older, you get a little more atherosclerotic, your vessels harden a little bit. We do see the blood pressure going up. So it typically tends to be older, but certainly we do see the younger also. But even in these patients, we're making sure it's not from other causes, like renal artery stenosis, fibromuscular dysplasia, or any other hormonal disease they may have that's driving up their blood pressure. So once that's been ruled out, then we'd assess them and see if they're a good candidate. So it's a percutaneous procedure. We'll go through the femoral artery in the groin. It's under conscious sedation, so they're sleeping through the procedure. The procedure takes about an hour. During the procedure, when we do perform the denervation, usually we're doing it in 3 different spots in the vessel, the renal artery, each time's several seconds, and they will feel a little discomfort. That some describe as a pinching, some describe as a burning, lasting only several seconds, and immediately goes away when the denervation portion is over. And the recovery is like they would with any kind of classic, a lot of them had heart caths before, so they kind of know. Right now we're using the groin. It would just be a couple days. They're not driving, they take it easy. Hopefully next technology will be going through the radial artery like we do most of our heart catheterizations, so recovery will be quicker. But they also go home the same day. So we'll watch them for about 6 hours post-op, and then if everything looks great, we send them home. Just based on the studies, you'll send them out on their current medications. You don't see a big precipitous drop immediately. Usually 1 to 2 months, you should start seeing their blood pressure come down. And at that time, you would be making some medication changes. And we are just now putting in place our hypertensive clinics, which will be a referral source. Once patients have gotten to the point where their primary care doctor or even cardiologists are having such difficulty to control their blood pressure, that they would be referred to us.